This was a deadly virus. You knew it was airborne. You knew on February 7th, you told Bob Woodward how it transferred from person to person in the air, how deadly it was.
There's a report that I have here someplace where China said it was airborne earlier than the statements I made. People knew it was airborne. This was nothing. This was no big. When I say it was airborne, everybody knew it was airborne. This was no big thing.
I know that in February.
Well, read the reports. China came out with a statement that it was an airborne disease. I heard it was an airborne disease. I assumed it early on.
Now then, airborne transmission of coronavirus doesn't just mean somebody spluttering next to you on the bus. It's about how tiny droplets of virus can stay in the air for quite a while. And that's a prospect which raises obvious worries about daily life. The World Health Organization this week says it's got concerns. Professor Wendy Barclay is chair of the Influenza Virology Department at Imperial College London, and she's a world expert on the airborne transmission of respiratory viruses and a member of the government SAGE committee.
Yeah, so what we know is that viruses can be expelled into the air from infected people in very small droplets. And sometimes even in droplets that are so small, we call them aerosols. And these aerosols can remain suspended in the air. And we do know that SARS-CoV-2, the virus that causes COVID, can remain viable, remain infectious in these very small droplets. COVID can be transmitted through these small particles that can travel through the air.
Good ventilation, absolutely essential. Now, we do know that there was a restaurant in Guangzhou in China where there was transmission through the air system. So what about air conditioning in all of this?
Some air conditioners simply push the air around inside a room. And so that's not really ventilation. That doesn't dilute the virus out anymore. But there are other ways of handling the air where the air gets sort of replenished and exchanged. So in those circumstances, you definitely would want to be in a well-ventilated room.
Well, we've heard it for well over 3 months now that coronavirus is spread by droplets from the nose or mouth. The World Health Organization now seems to be accepting the evidence of independent experts that the virus could be spread by dry particles in the air.
We have been talking about the possibility of airborne transmission and aerosol transmission as one of the modes of transmission of COVID-19.
The point is that if the virus is in the air, to prevent infection, we need to remove it from the air. To remove it in the air by building engineering measures, of which ventilation is one of the most important, efficient and effective ventilation. So this is number one.
Larger droplets can land on other people or on surfaces they touch. Spreading the virus through droplets is most likely to happen when you are less than 2 meters apart. Smaller droplets, called aerosols, can stay in the air for some time, especially if there is no ventilation.